For the face, you're going to break up the face into 5 sections. These sections are the neck, the cheeks, the eyes, the forehead, and around the mouth. The neck, cheeks, and eyes are going to be split in half. You're going to do the treatment in 5 minutes per section and 2.5 minutes per eye and around the mouth. The first step is to cleanse the skin with a facial wipe. You're going to start with the neck. You're going to create imaginary grid lines, about 3 to 4, on each side of the neck. You're going to apply gel to each section of the patient's face. The amount that you should apply is a very small amount, about a quarter size initially, and you should never apply more than 2 times per area. If you have to apply more than 2 times per area, you are applying too much gel initially or not enough gel. You're going to gently tap the gel onto the skin and not rub the gel into the skin. This will keep the viscosity of the gel thicker, so it can allow the probe to glide over the skin evenly. You're going to move from the outside of the neck towards the trachea in an upward motion. You're going to drag the skin upwards and glide the probe down so that the probe is not pulling the skin down. Then you're going to move to the other side of the neck. In step 3, you're going to move to the cheek area, starting with the mid-chin. You're going to drag the probe from the mid-chin to the ear. Then from the ear, you're going to move the probe to the nose and back to the mid-chin. Then you're going to move to the other side of the face. In step 4, you will move to the forehead. You're going to start at the temple and go across to the other temple and back and forth. You may have to set the temperature slightly lower. In step 5, you will move to the mouth area, 2.5 minutes each side, moving from the mid-chin up to the nasolabial folds. Step 6, you will move to the eyes. You're going to lower the temperature to about 1/4 energy. You're going to start in the inner corner of the eye and sweep across to the brow for 5 sweeps. Then move across the brow. After you're done with each section, you should gently wipe the gel off of the patient's skin for patient comfort. For a Therma-Lift treatment on the abdomen, you're always going to make sure that you provide protection for the patient's undergarments by applying a paper towel. You're going to apply the gel to the designated area. You're then going to create imaginary grid lines in a vertical position on the designated area. You're then going to spread the gel with the probe around the designated area. You're going to apply the probe to the body and slowly drag the probe in an upward motion and glide the probe back down. Drag the probe in an upward motion and glide the probe back down. So you're always pulling the skin in an upward motion. You're going to move the probe in this pattern until the skin is pink and it feels very hot. This technique should be used for all other body parts. After each cavitation treatment, the Therma-Lift treatment should be done for at least 10 to 15 minutes per area.